So sorry again for the technical difficulties, and thank you for hitting that record button. Wonderful. So hi, welcome. We're so glad that you're able to join us today. We're really excited about this conversation entitled Advancing Mental Health Equity for Youth and Young Adults. I have youth and young adults in my life. I'm sure many of you do as well, and I'm worried about them. I'm concerned about them, the impact of the pandemic on them the last few years. Everything with social media today. There's just a lot on our youth, and I'm really excited to have some experts in the field to take us through this discussion and give us some tips and tools as healthcare professionals on what we can do about this really important issue. My name is Rachel McCrickard. I'm the CEO and co-founder of Motivo. I'm also a licensed marriage and family therapist. For those of you who are unfamiliar with Motivo, I just want to quickly say we're a virtual clinical supervision platform. We have a nationwide network of some really incredible clinical supervisors, and we partner with behavioral health organizations and payers like Elevance Health in order to provide quality virtual clinical supervision. I also just want to mention that today I publish on a white paper that is about the unbelievable drop-off rate between the number of people who get a master's degree in counseling and the number who make it through the licensure process. So about 57% of people who get a master's degree in counseling never make it to licensure. And that's really because it's actually pretty hard to become a therapist. There's a lot of barriers and struggles that new professionals face on their road to licensure, and many people give up along the way. But the truth of it is that we need every single mental health professional we possibly can have that's qualified and ready to serve. So we published a report on what some of those barriers are and what we think that we can do about it. We'll post it in the show notes here. Would love for you to take a look at it and read it if you find it helpful. But enough from me. I'm going to pass it over to Meryl Friedman of Elevance Health to say her introduction as well. Let me also quickly say we are offering 1.5 hours of continuing education credit through the National Board of Certified Counselors today. You have to be here live and you have to stay through the whole thing in order to receive credit and take the survey at the end. But we'll be putting that in the chat so you'll know exactly what to do. All right, let me pass it over to Meryl.
Thanks, Rachel. Hi, everyone. So I'm going to be even super briefer because we have just had such a late start. Thank you for your patience. I am so sad we lost so many people because of the technical difficulties, but we're going to make up for it. The conversation's going to be excellent. My name is Meryl Friedman. I lead inclusive policy and advocacy here at Elevance Health. If you've joined us before, you'll notice that we changed our name in the spring of last year. Our parent company was Anthem. We are now Elevance Health. So if that's confusing, we can make sense of it for you. But it really is to reflect our evolving mission of being a trusted health partner, thinking well beyond those traditional healthcare benefits and thinking really holistically about people and people's experiences, which is why we enjoy our relationship with Motivo and having these conversations and really making sure we are digging in to those issues that are important to people and helping people navigate the world as we know it today. I'm a white woman with curly salt and pepper hair, wearing a black shirt. My pronouns are she and her. I have a virtual background behind me with our company logo. It is blue. We are really thrilled you're here today. Please bear with us on our technical issues. I've said this throughout the evolution of the series, how important it is that we continue to come together to have these conversations around equity and inclusion and intersectionality and person-centeredness and acknowledgement and affirming and inclusive care and really bringing these elements together because it is what we experience in our lives. Today, most importantly, Rachel already, teed that up, is really focusing on that experience of adolescence and sort of being able to have that agency and control over their mental health journey and being very much engaged because we are worried about young people, but we're also worried about young people and young people as we all age and how all of these experiences play in our health and well-being. So thanks to everyone who included questions in your registration. We use them to shape the content. So thank you for being part of that. And I'd be remiss if I didn't ask you to, when you're on at the end and you're taking care of your CEs, fill out that online survey, please, because that feedback is important to us just about the conversation, but also we use that to build out the topics and inform our next steps in the next forum in the series. And we'll start on time with that one. I don't want to jinx it anyway. I am so honored to share space today with the panelists you're going to hear from, and grateful for them and their willingness to share so much and so authentically. And on that note, I'm going to turn it over to my friend, Dr. Malloy.
All right. Thank you guys so much. Thanks for setting the stage there and giving that intro. Want to extend such a thank you to all of the providers and all of our collaborators who have joined us on the call and stuck with us through this, and I'm sure more will join as we go along. I'm always excited really to do these panels. To reintroduce myself, I'm Dr. Demetra Malloy. I'm one of the Regional Vice President Medical Directors at Elevance Health and have been a part of this growing series that we've had in order to, arm our great providers with other tools and expansion of some of their soft skills when they're dealing with and all of your clients, all of your patients that you're wanting to help, and really always trying to get better at doing that. So that's how we are approaching you and making sure that we arm you with as much as we can. We love to hear your questions. And on our panel today, as always, we have a lot of juicy expertise and I love to shine a highlight on people who have dedicated themselves to this area. And like everyone was saying, young people have been on our mind a lot, and we wanted to particularly shine a light on that developmental area. So when there's adolescents, when there's young adults, and really how do we get those firm, how do we build those bricks for them and give them a firm foundation to stand on when they're, growing into themselves, their identity, their mental health. And I know people have seen a lot of the more recent information and data that's come out around how some of this recent period that we've been through with the pandemic and the growth of social media and all of these pieces are really going into that. So we've got some experts here to help us talk through some of that and give some tools. I'd like to start introducing them. I'm going to go the alphabetical last name there. So I'm going to start with Siobhan Jones. She's a licensed clinical social worker and founder and CEO of Mental Wellness Collective. And that's a virtual group practice in Georgia. I'm also going to give everyone a chance to say more about themselves. I'm just going to list the three and then let them speak to you about their expertise a little bit more. So I'm also going to introduce Dr. Molly Staggs. She's a social worker who's been working with families for the past 10 years over multiple settings, whose focus is on policy and procedure improvement. And also we have Angel Zhang. She's a fourth-year psychology student and youth mental health advocate, committed to advancing equity through community-driven policy and research. I will pass it on to each one of them in just a moment to say a little bit more with this opening question of, can you tell us a little bit more? We all know why we invited you to this panel from a Motivo and Elevance's point of view. Can you tell us a little bit more about what brought you to this panel today and some of your expertise and what you are looking to share a bit from your experience today with all of our providers? Again, I'll start with Siobhan.
Thank you so much. I'm excited to be here because my journey in social work and mental health started with youth and families. And so I have started my career with youth and families. A lot of the introduction to this field started there. So my practice is a virtual group practice, so where I specialize in treating mental health needs for Black women and women of color and teen girls, with the specialty in helping teen girls who are dealing with self-harm, suicidal ideations. I've been in the mental health field for a little over 11 years now. And so I have worked in a variety of different areas and seen the need for our youth, not only just resources, but understanding the things that impact them, understanding their needs and being able to address those needs in a collective way. So I am excited to be invited here and to share space with all of you and see how we can get this information out there.
Thank you, Siobhan. Dr. Staggs.
Hey, everybody. I'm Dr. Staggs. I am a doctor in social work, a independently licensed clinical social worker. I identify as cisgender, she, her pronouns. I specialize in trans health. I published on trans health equity just last year. And I currently work as a behavioral health specialist within a Kentucky Medicaid MCO. So I work with very complex cases and making sure that provider relations with our trans members are, equitable and positive. And I personally have someone in my life who is trans and has really jump-started my interest in preserving their mental health and the future that comes for them. So this is a topic that is very politically driven and important, and it's very difficult to talk about. So I'll be very forthcoming and say that I'm incredibly nervous to speak on a topic that I love so much, because there are so many opinions, but there is the underlying, necessity of us taking care of the future of our trans people. And I hope that with this discussion, it comes with a space that you can have the opportunity to ask questions. There's no judgment. This is truly a conversation for us to improve the ways that we interact with trans people who are coming in for services and similar.
Great. Thank you for your perspective. Angel, can you introduce yourself?
Yeah. Hello, everyone. My name is Angel. I want to echo the gratitude shared by Dr. Staggs and Siobhan about just being able to be here today and engage in this really important conversation with you all. I use she, they pronouns. I want to start off by sharing a little bit about my lived experience, because that's really informed my, academic and professional background. So I'm a first generation immigrant and college student, low income, woman of color, and also I'm a queer woman of color. And so having those experiences growing up and also having to deal with that growing up in a predominantly white neighborhood, predominantly high income neighborhood, really drove me in college to seek out opportunities that really gave me the vocabulary and tools to address those experiences and the structural issues that impact them on a policy and research level. So my junior year, I was a service learning fellow with this organization called Little Manila Rising. It's a Filipino-based organization in the historically disenfranchised region of South Stockton in California, dedicated to serving the population through equity advancing programs. I worked specifically in their mental health equity program, working on decolonizing mental health, working on community organizing around mental health. And then later I served as one of the first NAMI Next Gen Fellows for the National Alliance of Mental Illness, and which was a kind of youth group of national mental health advocates dedicated to informing policy and programs for the National Alliance on Mental Illness. And so those experiences have really driven me to continue this work. I'm an aspiring doctoral student. I really want to use research to engage communities that have historically been left out of what mental health constitutes, what mental illness constitutes, because of the way, psychological research has focused on the experiences of a historically privileged group. So that's my background. And again, I'm really thankful to be here with you all today.
Thank you so much. So we'll get started sort of at a high level with things, and then, sort of peel back the onion a little bit on different areas. It's such a vast area to cover. But what do you think are the most significant challenges facing young people in accessing and being part of mental health care, and how these challenges may differ across different communities and populations, particularly maybe the subpopulations of BIPOC youth, queer and trans youth, and how do you feel like the main challenges that come across all youth, and then maybe some of the subpopulations are panning out? Can I start with you, Siobhan?
Absolutely. So something that I have noticed as being a barrier, a few things actually. One is a lack of providers. And so because my specialty is working with Black youth and Black women of color, I find that a lot of Black youth are wanting to connect with the therapist who looks like them. And sometimes they are in areas that do not have a therapists who look like them, therapists who are Black or people of color or things of that nature. But another barrier that I find also is an issue is the perception of the youth's mental health from either their parents or the school. And so because it's not taken seriously by their parents, it's not taken seriously by the school, they often are dismissed. I find a lot of youth that I have come in contact with are labeled as like problem children. You know, they're problem children and they're a behavior issue. And although that may be so, there are usually some underlying mental health issues that are getting ignored. And when we talk specifically about Black youth, there's a lot of racial bias. And so when we look at studies that show with Black youth who, especially our Black boys, they are overrepresented in diagnosis of conduct disorder, oppositional defiance disorder, as opposed to their white counterparts who are oftentimes diagnosed with ADHD and things of that nature. And so I find that the diagnosing has a lot of racial bias, and that definitely impacts their wanting to get treatment, them wanting to be involved in the treatment process, and how practitioners are engaging with them as well when they come in with a diagnosis already of ODD or oppositional defiance disorder, especially at a young age.
Certainly can understand that, and how that affects the treatment plan following, right? The diagnosis starts down a path.
Exactly.
Dr. Staggs, what do you consider some of the biggest challenges facing youth in general, and then some of the other subpopulations?
So like Siobhan, I would say that a lot of times for trans individuals, they are wanting people who are also trans. And unfortunately, the reality of it is there is so much invisibility within our society that we are not there yet. And it is something that is because of the binary expectation that we've created when we come into any medical framework, whether, including mental health too, we sort of alienate trans people who are seeking care because of how we directly and almost immediately interact with them. And it relates to how we diagnose and how we, just interventions and expectations. The statistics relating trans mental health is so concerning. And it really, if we look at like just the basics of it, it's really the assumption that our society has created with the harmony between gender and sex. Even just a greeting is gendered. And so I think some of an immediate issue with accessing mental health is just how we approach introducing ourselves to create a safe space to then proceed with whatever treatment it may be. So, for example, like talking about just the simple word of preferred. So what are your preferred pronouns or your preferred name? And I really implore everybody to just like consider what weight is on preferred. It just sort of gives the assumption that I'll take whatever, like there is one or the other. But I think trans people have just been so ignored in many ways that even things that we don't necessarily immediately recognize are impacting and creating barriers and challenges for them to want to continue pursuing treatment, which in hand relates with negative health outcomes. So I would, for the trans group, I would say that it would have to be the visibility to be the biggest barrier in accessing the care that they need. If they saw other people who took initiative and treated them with, care and dignity and respect. I anticipate if people on this call have not already worked directly with a trans member, you will. And it's something that you've got to just prepare for, and thinking of how you will or have interacted with them is going to be a great sort of determinant of whether the mental health of trans adolescents and youth are going to improve in the future.
Mhm. No, I no, definitely agree that. So acknowledging biases of all types, right? When you step in, including language, which is really important, right? And setting just space to establish like what some of that language should be moving forward, right? Not assuming. Angel, when you think of this question of the biggest challenges facing youth in accessing mental health and getting the care they need, and some of the subpopulations and their additional challenges, what comes to mind for you?
I think of this memoir written by Korean American poet and writer Kathy Park Hong. She opens the memoir, it's called Minor Feelings, and it's talking about her experience as an Asian American woman growing up and navigating that positionality. And she opens it by saying, I have depression. I wanted a therapist. I didn't just want any therapist, not an Asian American one, but a Korean American therapist. And with those, few lines, she kind of speaks to the importance of culturally responsive care that acknowledges that the way we've constructed race is very homogenizing for a lot of communities that have different histories of, displacement, immigration. So I feel like that has been kind of the driving ethos of my work, acknowledging the fact that our current frameworks, our current understandings of not only mental health, but race and categorization, social categorization, leave a lot of room for erasure rather than visibility. And that's just how the way the systems are built. So a lot of it is systems informed work, acknowledging that we need not only more therapists of color, practitioners of color, but training in these curriculums that train these therapists on how to acknowledge that, race is nuanced, ethnicity is nuanced, and that these experiences from different cultural contexts need to be acknowledged. I think growing up, like I struggled to find like a practitioner because a lot of the kind of language assumed that trauma and like struggles were self-contained rather than shaped by your social context. And I think a lot about the rise in Asian American hate crimes during the pandemic, and how there was a lot of suffering in my community, but there wasn't a lot of like practitioner training or like equipped practitioners to address how racial trauma is both individual and collective, and how you have to address that collective component and systems informed component if you want to help the individual, because individual is, no matter what we want, we're still part of that system. We're still, beholden to that system. We're still our daily experiences are shaped by those systems. In addition to that, I think there just needs to be more engagement of stakeholders and communities in building interventions and solutions. I think of like research. I really love this upcoming framework called Critical Participatory Action Research, which is a framework for community-driven and community-based research that engages stakeholders in research design, research methods, research outcomes, because psychology has historically been WEIRD, which is an acronym for Western educated, intelligent, rich, and developed countries developing what mental illness looks like, when that again is very exclusionary and very, perpetuating a system that has again historically excluded a lot of communities of color, communities that don't subscribe to a cis heteropatriarchal perspective on what mental well-being looks like. So I think a lot about the demographics of practitioners, what those practitioners are being trained in, and also the research methods that determine, how we think of mental health, how we determine solutions and policy.
Wow, you all have given us a lot to think about there. So we heard about different biases, right? Approach, language, training, as far as some of the challenges that affect an individual, youth, but also, are built into the system, right, and need to be addressed as well, so that that system is more accommodating and inclusive as well. Some of the things you guys were talking about, because we talked about different areas and different subpopulations of our youth, I'm interested to know your thoughts on how do we ensure that mental health is culturally responsible, to use your term, Angel, and in addressing these diverse youth populations, and particularly at the intersectionality around people. Some people highly identify with one area of their identity, and that actually might change as they grow and develop as well, and their experiences in life. But oftentimes we identify with a number of areas very strongly, and that really contributes to how we experience life, how we look at things, and like you were saying, Angel, how we define mental wellness, and what that looks like for us, right? And so how do you think that we can help our providers on this call and the system in general to say, how can mental health be culturally responsible in that way, and really think through addressing that intersectionality, because people are nuanced and complex, right? And we're here to work through them with them individually and how they identify and live through life. I'm going to start with you, Angel.
So my first inclination is to bring in the social determinants of health, because I think that's a really important framework that has become very prolific over the years, rightfully so, about addressing how one's socio-political, economic, cultural context factors into their ability to be healthy. And I argue that this framework needs to be extended to mental health, acknowledging how, economic instability, historic marginalization, lack of adequate food, lack of adequate medical resources affects someone's ability to be happy, to be, thriving in their life. Mental health isn't just the ability to go from day to day. I think it's the ability to thrive. And a lot of communities have been intentionally deprived of that ability through legislation, through institutions of power throughout the years. And so I think, again, a lot of the conventional understandings of mental health acknowledge it as purely an individual phenomenon, when it has to be deconstructed in that institutional structural context. And I think of trans folks, as Dr. Staggs brought up, 82%, the recent study, 82% of trans folks have experienced suicide ideation. And that's not just, an individual phenomenon, it's a collective response and to the legislation basically undermining their personhood. It's a collective response to a gender binary that threatens erasure every single day. And so we can't just say, oh, you're going through a lot. It's your community is going through a lot, and we have to address you as a whole and address your struggles as a whole in order to help you thrive individually. And that mental health care providers have to be able to address this greater context in order to understand how diverse populations grapple with their day-to-day positionalities. I think also of a professor I've had in college who is a behavioral therapist, and she talked about, because she's a behaviorist, she has obviously behavioral principles that she abides by, and she talked about how being a minoritized population in this country is positively punishing every single day. Positively punishing means it's a consequence to behavior. In this case, behavior is just being able to exist as yourself that gets decreased by punishment. And so there's literally structural positively punishing factors that undermine the ability of underprivileged and underserved folks to thrive every single day. And their ability to thrive cannot be addressed without addressing, again, those structural factors, those social determinants of mental health.
Got it. Definitely a good framework to consider there. We've certainly used it in all sorts of other areas of, healthcare and well-being. Siobhan, I want to move to you as you treat clients in this area and deal with the intersectionality. How is it you think that providers can consider this and in their conversations, in their therapeutic plans with these clients, really have that consideration in informing the plan and executing it?
Yeah, I think that something that we need to take into account are ACEs, our adverse childhood experiences. There are, when I talk to a lot of clinicians, some are not as versed in adverse childhood experiences, but a lot of the clients that I deal with who are adults, even moving from youth, have so many things that have happened to them in childhood that have not been addressed. And to Angel's point, when we talk about, the environment, in grad school, we talk a lot about, as a social worker, PI, person in environment, right? And so we can't just look at, this person as an individual. We need to look at them collectively. How is their environment being shaped? When I worked in schools and, even now in private practice, something that we have to take into account is how is this youth, when they leave their home, what are they enduring as they are leaving from their house and getting to the school building? Because if we're trying to address their mental health, we solely can't just look at their diagnosis and treatment plan from there. We have to look at their family. What does their family have access to? Are they eating? If I don't, it goes back to kind of Maslow's hierarchy of needs. If I don't have food at home and I'm starving, I can't function in my classroom. If I don't have, if I'm walking through a war zone to get from home to school, there's so many traumatic experiences that are happening on the way that have to be addressed. And so often when I look at treatment plans in schools, we are solely focused on that individual, how they're functioning in the school system, if they're doing good with their grades, if they're not, if they're, what is happening behaviorally. But there's so many things that play a role in it. And when we look at the adverse childhood experiences and you look at, domestic violence, you look at child abuse. When I worked for the Department of Family and Children's Services, there were so many youth who were living in poverty, who were neglected, who were trying to just make it. And we had to address those issues before we could even get to some of the issues that they were dealing with mentally. And I think that a lot of times when we're dealing with practitioners, this is where some of the racial bias comes into play. A lot of people are not addressing it because one, they have never experienced it or been exposed to it. And so if I've never been exposed to it or even talked about it, I don't know to address that. When we talk about our graduate studies, we have to learn to broaden our treatment methods that we use. Some of the treatment modalities that are used, for example, cognitive behavioral therapy is something that I think that everyone uses, and it's kind of like that go-to framework. But cognitive behavioral therapy actually does not work with everybody. And I think that when we use one central method as our go-to, we miss a whole population of people. I am happy that so many more practitioners are getting trained in brain spotting, EMDR, and those are great modalities, one, for people of color and who are dealing with trauma and being able to address this trauma. But the barrier that I see is that, one, these trainings are super expensive. And so because they're so expensive, a lot of people don't have access to it. And so therefore we fall back on, and nothing, I'm not saying fall back on as a bad thing, because I used elements of cognitive behavioral therapy as well, but we have to really broaden that reach, not just in grad school, but also in the workforce, in the trainings that we have access to. When I worked for the state, and I did a lot of trainings around suicide prevention, but you would be surprised how many clinicians are not versed in suicide prevention. They don't know what the risk factors are. They don't know what the risk factors are for different populations. Different demographics have different risk factors. They have different things that you need to look for in order for you to be able to address the suicidality. But because we don't have the basic training around suicide, it's something that a lot of clinicians aren't able to address. Also, in addition to that, I kind of go back to, we talk about families, being able to include the family in that conversation. When I was trained in ABFT, which is attachment-based family therapy, it talks about really including the whole family in that, in trying to treat the youth as it relates to suicide. It's not just a individual phenomenon, as Angel pointed out, because when we look at it like that, we miss so many of the warning signs, the risk factors, and prevention elements that we can also address as well.
Very good point. I mean, we also really limit, as providers, our ability to build meaningful discussions and trust with our patients, with our clients, right, as well, so that there is space for them to speak about these things that are really impactful, right? We've narrowed them down to like what's acceptable. And obviously, so I'm an internist, but obviously if I only treated like part of the issue, that doesn't get to everything, right? If I've just said like, oh, you just have high blood pressure, but I haven't addressed your cholesterol, I haven't addressed the fact that you're pre-diabetic, et cetera, I need to widen the lens to say, what is holistically, what are all of the things that may be contributing to your health status or well-being? So certainly, you know, expanding that out. And that's why, you know, inclusivity conversations are really important. Molly, when you think about what is it that like the system can do a bit more to be culturally responsible, to create a better environment for people who are dealing with multiple identities, intersectionality in different ways that are not currently being addressed, what comes to mind for you?
So it kind of goes back to the verbiage of how we are saying chosen, preferred. I think that's a good place to start when it comes to becoming culturally competent with working with trans people. But as practitioners, I think what's really awesome is the fact that anyone who is familiar with, you know, psychopathology and the DSM, you can be culturally competent with working with trans people. And I know that it can be intimidating for many people to take on a trans client. And unfortunately, it just becomes like a hot potato of referrals. And so if we could start with sort of recognizing that it is so crucial to not bring in the binary expectations into whatever service you're providing, it's so limiting. So if you start there and have an open conversation of like, you can be whatever you want to be on the spectrum, you know, that just provides such an opportunity for people who are not identifying within the binary to come forward to receive assistance, because like the other panelists, like it's you have to also consider how like how you are reaching them is so important. And so when we think about like when I was thinking about how to encourage cultural competency with trans members, my recommendation would be to start at CBT. You know, I know that it is the basics. So that is sort of what is so great about coming forward and being willing to work with trans people is CBT is great for anyone who just needs some affirmations, and it's so accepting. So yes, it is something that does not work for everybody, but I would say for the beginnings, when you are unfamiliar with working with trans people, that's so great. And to piggyback off of that, I mean, talking about EMDR and brain spotting, I mean, when I was trained in those, and to be able to do that through telehealth with clients, just it increases accessibility. And trans people are so reliant on online treatment to any degree. And so when we think of how to be culturally competent, to sort of recognize what is so important in reaching these people, and that you kind of have to adapt to what you're familiar with. I wouldn't go into a referral trying to dig at someone's gender identity. It's just not the primary focus of a lot of people. And I know that that is like a common concern from practitioners that I've talked to, is just, you know, I feel like I'm going to be doing something wrong when I'm working with them. What if they regret it? You know, XYZ. And I think what is often missed is that gender is such a small part of a human being, and that, you know, treatment is much broader than just working on figuring out like who someone is. And so that kind of goes back to what Angel was saying about the social determinants of health. Yes, trans people experience a greater statistic of almost every single, you know, mental health issue there is. I know Angel brought up the suicidality, but to give it a little bit more perspective, I mean, I think the latest statistic was, I think it was like close to 45% of the total trans population has attempted suicide. And the flip side of that is I think it was only 5% of cisgendered people in the country have. So, I mean, thinking about 5% to 45%, that's a lot. And so crisis intervention is so crucial when we talk about being culturally competent. So I would completely agree. Treatment or like trainings on suicide is far and few. I would say for me personally, I think when I received the best crisis intervention training was when I was working for a rape crisis center and not through like the state required suicide trainings. So to me, that's kind of telling. If, you know, you're not really anticipating and it's just very surface level, it's just not enough. So what I would encourage, if you are interested in working with trans people, think about how your documents are labeled for intake. Think about how you yourself are asking questions. Think about just how you want to plan treatment, make it individualized, because I mean, they deserve it. Nobody is disposable. And unfortunately, a lot of times trans people do feel that way. And so if you as a practitioner want, you in your bios could also put that you are trans affirming. That is huge to get prospective clients, because I mean, you could go, there actually is a website for you to sign up if you want to be nationally labeled as affirming. So you could do it that way. I know personally, I haven't done that yet, so don't feel too bad. I need to be doing that myself. But if it is something that you're interested in, there's also consults who can look and see what you're doing within your paperwork, give recommendations, just giving some basic consults of like, this is what you could be doing better for, you know, equity purposes. It's actually called the Equity Project. So if that is something that you all are interested in, it's pretty great.
Yeah.
Sorry, that was long-winded.
I like that you guys are listing particular resources and places for people to go. Obviously, we assume that the providers on the call want to learn the skills, and just like anything else that you already learned, right? There are places that you went, documents that you read, right? Professionals that you followed and listened to and heard instructions. So, as we go along, we'll certainly be accumulating those specific places that you can look as well for all of those things. I want to leverage, what I'm hearing across the board too as well is that, sorry if there's background noise there that I can't control. I'm hearing across the board that it's a lot about the approach and, really trying to make sure that you're looking at the fact that there are underlying assumptions. We all have them about everyone, about people, about environment, and being willing to challenge those and or at minimum to leave space for if your client or patient challenges them to not push back, to not invalidate, right? Whatever they're bringing into the room. And I know that, a lot of providers have been trained to do that in a number of different spheres, but it's really trying to look and see specifically at these things that we do all of the time. I found myself, to be honest, I wanted to say thank you, ladies, at some point. But when I was introducing the webinar, like with myself, I have trans people in my life, people who identify as lesbian. I love them dearly, and I struggle with it because I've been trained to be a certain way, to have certain defaults, to have certain biases. And so really, I think the important thing is, noticing that, acknowledging it, not necessarily judging yourself for it, but coming with the approach of, that doesn't work for everyone. So if your intention is to work with your client or your patient, checking yourself on those things, and coming with good intentions in that way, even for the most basic things that we default to, which can be a little bit like more effort. It's, uncomfortable, but it really does. The point is, it really does make a lot of impact, and you have an ability to make a lot of impact for that person if you're willing to do that work. So we're just trying to give some, really tangible tools on how that might look. Acknowledging the discomfort and trying to, help arm you through that. I wanted to pick up on some of the things that you guys have already put down around leveraging technology too, and some of the digital spaces. I know, Siobhan, you have a virtual care practice, speaking about Dr. Staggs, that you were speaking around how people use online resources, different things like that. How can we use technology, digital resources I might have to increase access, to actually help with equity and availability and different things like that? And how have you maybe seen that play out in your own practice or your own career? Siobhan, I'll start with you.
Yeah, so having a virtual practice, one, it has broadened me being able to access people outside of just one area. So being able to access the whole state of Georgia. And I love this because a lot of times what happens is people sometimes don't want to come in face to face. Transportation is an issue, so it's a barrier. And so technology allows you to be able to be in the comfort of your home. I have a lot of youth who obviously always have phones, but they don't want to come and sit in, as they say, come sit on the couch. They want to be able to be in their bed, sitting on their bed, having their phone, and being able to access their therapy session. And I think that, with the pandemic, it has really normalized virtual therapy. I think that technology can, if used properly, can be such an asset, because one of the things that teens love is to be with their friends, community, and if the pandemic has taught us nothing, even as adults, being able to have access to community, to friends, to feel a sense of belonging is important. Dr. Staggs touched on this as well, of being able to, we want to have this collective approach, right? We want to be able to create communities where we are, and technology allows us to do that. But on the flip side, we have to really be mindful with our youth of what they're accessing, of how long they're accessing it. There's been ongoing conversation in the media about TikTok, banning TikTok, and all of these things. And I believe I think earlier this month, TikTok increased their time limits for youth under the age of 18. And so I think there's a 60-minute screen time if you're under 18. But I also think that they have limits. They increase their parental controls as well. And so not only youth are very savvy with technology, what I've noticed is the parents lack the ability to access some of the things. And so I've had to educate, even as a practitioner, not just throwing it out the window and saying technology is bad. I've had to have conversations with parents. Kids are going to have access to technology. We are in a technology world. It's not going anywhere. And so how can we make this appropriate for them? And so looking at their age, is it harming them? We do know that, those, there was a study that I read, and I can't think of the name of it, but it said that over 59% of youth had experienced abuse online. And so not only was the abuse, maybe if they were being bullied in school, it continued when they got home because it was accessed through social media. I've worked with a number of youth who a lot of the mental health, the stress that they were dealing with was because of technology, people DMing them, sending them things, dealing with exchanging sexual content, all of these things that they're dealing with, but they're dealing with it privately. And so having conversations with parents, how can we make this safe for them? And so educating them on, the tools just even on their iPhone, using screen time. With my own daughter, when she was, kind of matriculating through middle school, now she's in high school, of setting these parental controls of screen time, how long you're going to be able to use your phone, when it's going to shut down. And she would always get upset because it would shut down at a certain time. Also limiting the apps that they can use. If you are noticing that they're exhibiting mental distress because their exposure to social media, intervene. Early intervention is really the best medicine. And so being able to limit those apps, being able to limit, the music that they're listening to through their phone. There's so many parental controls that we can put in place to be able to help them. Something else I wanted to add is that there are a lot of apps that are helpful resources for youth as well. And so I really want to, a lot of times, like I said, we talk about the negative impact, but there's so many important resources that that teens can access at the tips of their fingers. In my practice, whenever I do a treatment plan with anyone, but teens in particular, I have them download the My3 app. And it allows them to input the treatment plan that I send to them in the document. They can put it has the same template, and they can put the the safety plan into this app. So My3 correction is for their safety plan. And so they don't have to carry around a paper. They don't have to say that they lost it. It's in our session, we go through and they input it into their phone so they have it. Not only do they have that in their safety plan, it has numbers that they can dial. There's another app and it is called Not Okay. And it was created by 2 teens. And the app allows you to be able to put in their emergency contacts. And if you're not okay, you can press a button and it will send an alert to your emergency contact, letting them know that something is wrong and you need help. And so the iPhone also has, which I did not know this, but I just learned, a team told me this as well. On your iPhone, when you're going to turn it off and you slide over for your emergency, if you hit that emergency icon, it will send an alert to your emergency contacts that you have that you're in distress. It will send them a text message. I've tried it and it will alert them and it will say that, I think the text my mom, when she called me, was saying that that I was in distress. And so it gives them an alert. And so being able to utilize social media and apps and the phone to our advantage to be able to protect our youth, because they're going to use it. And we don't want to cut them off, because I've seen more harm in parents completely cutting them off from their friends, especially when you are in an isolated area. Things like the pandemic coming up and you not really having access to be able to go out. Your community is important to you. And when we're talking about, I know Dr. Staggs will probably touch on this, but when we're talking about trans youth, being able to have that community that they identify with, that they can reach out to, is super important. And so instead of taking it away from them, finding ways to keep them safe and nurturing it as well.
Thank you for all of those specifics as well, for sure. I think those are important conversations to open up, but then also specifically to give someone somewhere to go. Angel, when you think about leveraging technology, sort of the digital resources for our youth and young people, increasing their equity, their community, et cetera, what are the things that come to mind for you?
I absolutely agree with everything Siobhan shared. Just the power to connect is obviously the most beneficial part of social media. There's a few organizations I follow that have been really impactful for me to just see, but also know in my heart that they're helping people who look like me in such a tangible way. One of them is Asian Mental Health Collective. After the shootings in Monterey Park and in the Bay Area over Lunar New Year weekend, they offered free therapy sessions to Asian Americans affected by that racial trauma, up to I think 8. And then another organization, I think is the Cypress Resilience Project. And I was able to obtain like free mental health first aid certification for adults through that program. So being able to both access resources, but also build capacity within the community for resilience and for advocacy, which was so powerful to me and important. I also think that kind of the idea of like mental health hygiene through online spaces, obviously like body dysmorphia, disordered eating, those issues have become really prolific over time because of, the unhealthy beauty standard imposed on youth through social media. And I definitely suffered from that. But on the other side, like I was also able to find people who were really educated on like systemic fat phobia, the way that the beauty standard is inherently racist, and also a product of the imperial, project, European colonialism. And so I suffered from, seeing that, but I also was able to get the education to deconstruct my expectation for myself. And now I feel much better about my body image. And now I know like what is actually, the structural history of this standard that I've imposed on myself. Is it, it's not something that's natural or essentialized. It's a product of social marginalization of certain communities and the uplifting of certain features over others as a form of, structural oppression and hierarchy. So I think that's really powerful, just the education that's so accessible to youth now, and being able to give youth, media literacy to say like, okay, like being able to explore the internet, like we'll never be able to, restrict that because like Siobhan mentioned, youth are very savvy, speaking from a young person, but also understanding that there's a way to give them the opportunity to leverage online spaces for community and education. And that's really powerful. And I just think that it's a really amazing way to connect. And over the pandemic, it was a way for me to connect. And just in general, it's a way for communities of color to build capacity for resilience across the world. I also think of when I was serving at Low Manila Rising, I was often the youth rep for certain like collaborative spaces. So I served for the Behavioral Health Equity Collaborative, and that was all on Zoom, and it was across the state of California, and it was all stakeholders, youth, practitioners, researchers, community organizers working together to, again, build resilience, build sustainable practices for resilience and for recovery. So absolutely, like, I think it's really powerful, and I agree with everything Siobhan has mentioned.
Those are really awesome resources, you guys. A lot on education, a lot on community building, right? And just increasing confidence. I think it's super important for practitioners to know those exist and to encourage them, right? Because when you're not with them, they need other help, right? And other resources. There's apps, right? There's ways to connect to your community when there's distress, et cetera. So I think those are all really, really helpful. Dr. Staggs, I want to add to that question as well, on top of the like tech and digital piece, and pivot a little bit to what Angel was talking about around the impact of media. Right. So social media in general, right. The different standards. I did want to, bring in conversations around, body dysmorphia, particularly for young people who are disproportionately affected. And the other, mental health and sort of beauty standards and identity and image development issues that come, and how do we use tech and digital spaces for some of that, or push forward policy that supports that. And then, how do we as practitioners champion that as well? So those are available for our patients.
So to also just like add just a few more apps in your little queue. So for trans people, something to consider that's really helpful is to encourage, there's binder reminders. So it's very medically damaging if someone were to wear their binder for a prolonged amount of time. So there are those kind of apps. When we're thinking of like, when we're not around, what are things to help, manage their physical and mental health? And so that's one that I just wanted to kind of throw out there. If anyone does work with any trans members and needs to sort of check on them in that way. But when I'm thinking of media, gosh, the media is so harsh on trans people. It is just heartbreaking. When we see trans folks that are depicted, it's in such negative ways. And I mean, this goes back forever, but I think about how the sort of realization that someone is trans, that it is depicted in a way that is disgusting. And so that is ingrained in us who have watched it. And especially for the people who are living trans lives. I mean, it is so ingrained in the way that we interact with trans people, like the way that they are depicted in the media. You know, whether it's the, you know, seen as sex workers or seen as drug users and things like that. But the media does not take it a step further and look at like, why are the numbers so high for trans individuals who, I mean, the realization that homelessness is rampant in this community, but not taking the time to dismantle it. So I think media is not great for the trans community, but flip side, it can be really great because we see trans people who do not take acting positions that, you know, depict negative trans experiences. Like I'm thinking of Laverne and it's what, someone throw me a bone. What is it? Orange is the New Black. Okay. So like that was something that was really positive for the trans community. So it's, I would say in my mind, it's not great. It's getting better. So when I think about protecting trans exposure, like children to what the media is saying, doing, I think it's necessary, but it also goes back to the sense of community. Like they have to have access to, you know, their group in order to live. I mean, this is a life-saving decision on behalf of like parents and things like that. So to kind of go into the policy, I'm kind of jumping around. So right now there are over 400 anti-trans bills across the United States. So, God, that number is just so high. And we have to think about why those are even coming forward. And the ignorance related to understanding what trans livelihood is, and what the government is trying to control just is arbitrary and annoying. And so like, for example, one of the things that some of the bills are wanting to do is to keep trans youth from accessing surgical intervention. And that's not even something that even the standard of care that practitioners refer to is like the standard of care does not agree that people who are young should have access to anyway. So some of these bills just do not align with what practitioners can do, would want to do, and it's just a way to control. And
it certainly can be a challenge to all of the patients, right? Like they're coming in that context, right? And so, and it's not under their control at all, right? So, you know, they're having to deal with sort of that in the background, and still just seeking help with the practitioners, you know, to work through that and as a part of their reality, right?
Right.
So certainly. No, I understand that as a important backdrop. It's part of that like bigger context, right? Like what is it that your patient's walking in with? And the reality of the, feeling attacked from their external environment or from elected officials or from whatever policies are up on the table for debate is something that, a number of subpopulations have to deal with, trans and queer youth as well, certain minorities who are not at the table and understanding and not drafting, how solutions are being made for them as well. Everybody still wears that and has to deal with that in their real life. So they're going to bring that into the therapy spaces, right? And certainly being knowledgeable about that is really, really important thing to always keep in mind, right? Like, what is it that you need to address and what is it that's front of mind for them when they're really feeling this kind of environment, for sure. I definitely want to make sure I leave space for you guys we've been sort of labeling some apps, some resources and, tools for practitioners to use. And for this last question, really to be more on what other tools and resources you can label, but I'm looking at the concept of resilience, right? So, a lot of these populations we've been talking about have been, they have a lot of challenges, we've labeled them, but they're making it through, they're finding community, they're trying to find ways to redefine and just have the space to define themselves however they want, right? And make it through as well. And as you guys have been specializing and working with them, what have you seen that are like the best promising strategies for building resilience, for making sure they do have that access, they do have those avenues? And how is it that practitioners can help encourage those, whether it's like, building with community-based organizations, the communities online that you were saying, how is it that our practitioners and advocates online with us can help promote those resilience pieces for young people as they're walking through their journey? Angel, I'll start.
One of the most powerful solutions I've participated in and helped organize was something called Kwentuhan, which in Tagalog means a storytelling community circle. And at Liminal Rising, they had these like storytelling community sessions that were open to people in the community to come in, and there was a culturally responsive facilitator who was an expert in culturally rooted healing, who would just facilitate like a conversation around personal narrative, around struggle and trauma. And it was just a really powerful way to use, a historically informed practice to build resilience in a present day community. And this has been, I think storytelling, honestly, across many communities has been a way to build a community and individual resilience. And so more culturally rooted practices like that being not only pushed to the forefront, but being, maybe covered by insurance, being recognized as a practice that can be taught and trained and be normalized, I think is really important, because right now, even if that has been a really powerful intervention, there's still this really disparaging label of like alternative medicine that's attributed to non-Western forms of intervention and practice. And so we really need to deconstruct what like alternative means when a lot of these practices predate colonialism and the modern conception of race we have today. So really, again, engaging stakeholders in the design of solutions, recognizing those solutions to be culturally rooted and, based in these practices that have survived with those who have gone through so many years of marginalization, and understanding that there's a reason why these practices have survived. They've been a way for these communities to build resilience over time, and that they need to be held at the forefront and no longer labeled as alternatives or, non-conventional, because again, questioning the idea of convention, I think, has been a really important through line throughout this whole session, understanding how we've been socialized to view certain things as norms and recognizing that unlearning is as important as learning in this context when we think about advancing equity through both research and practice and also policy. So yeah.
I certainly agree with that. That last statement about unlearning, I think, is really important, right, for us to understand and to not necessarily judge ourselves. Like we learned something that maybe doesn't work for us anymore, right? Like to maybe unlearn that and learn something new, and not to say that, not to necessarily put big labels of like you're wrong or you're a bad person. It's just like you learned something, it's not really working, learn something new, kind of, that's more helpful for sure on all of those different pieces. I have I specialize in more physical health as an internist, and I do have a colleague that I respect really greatly, because even in his 60s, went back to learn more about what we used to call sort of like Eastern medicine or alternative medicine, right? And now it's actually called integrative medicine. So changing the word, like saying like, there are pluses and minuses and pros and cons and things to learn from all kinds of practices of medicine. And that the point is to integrate, right? And what works. And actually started running an integrative medicine work group that I learned from him greatly. And so I just think it's never too late. You can always do it and always improve. So I certainly think that can span across. Siobhan, when you think about building resilience and different tools that can be used for that in the patients that you serve or patients at large, how can practitioners champion that and help that?
Yeah, I think there's a couple of ways. One, to Angel's point around building community. When you think about people of color, community is really big. And so you can't, when we think about like schools and youth, I believe in empowering our schools is really important, but it's not just the student at school. You have to empower their parents as well. Because if I give the child all of the tools, they have to go home at some point. And if the parents aren't involved in that, we kind of limit their ability to be resilient. They can be resilient at school, but then when they go home, and it's not mirrored and it's not modeled there. And so empowering our schools, I truly believe in upstream prevention because I believe that it gives them a lot of the tools that they need as youth before they get to a crisis. And so I always tell schools, if we give kids the tools that they need before they get to a crisis, then they'll have what they need when they get there. A lot of the pushback that I would get when we would go into schools, especially elementary schools, when we were doing suicide prevention, they didn't want to talk about suicide. They didn't want to talk about mental health issues. And so I said, okay, well, we don't have to talk about suicide. Let's just talk about coping skills. Let's just talk about conflict resolution. How do you regulate your emotions? Let's talk about those things because that's how you build resiliency. And so using things like the good behavior game, helping them to utilize these skills that then impact a lot of other areas. And so being able to also mentors, when we're in communities, low income communities, being able to have people go into these communities who can speak from experience really has an impact on youth. And they really start to see that, okay, if they can get through it, I can get through it. But if they never have anybody to show them, or they don't have anything to see, I always tell my clients, there's so much impact in looking forward to something. And so being able to look forward to something, you came from where I came from. You dealt with some of the struggles that I dealt with. You're talking about it. And so being able to model that behavior helps to build resiliency. And then on top of that, empowering the families. And so I know I spoke about this before, but I'm really educating our families. I think a lot of times parents kind of get left out of the equation because we are really focused on the youth, but we have to remember that they have to go home back into the environment where they're at. And so we have to teach the parents, a lot of the skills. When we talk about some of the low income neighborhoods and communities, sometimes the parents have never got some of these skills. They never learned some of these coping skills. I work with a lot of adults who, when I talk to them about coping skills, we talk about boundaries or conflict resolution, it's a new concept for them. And they've never talked about it. And we dig even deeper into communities of color. It's not something that we talk about in our homes. Mental health issues is not, we're starting the conversation, but it wasn't always something that we talked about. And so starting those conversations, letting them know that it's okay to talk about it. Transparently speaking, my daughter told me the other day, well, what if you like feeling sad? What does that mean? And so I'm like, well, what do you mean? If you like feeling sad? I'm like, are you feeling sad? And she was like, no. She's like, well, a better way is, what if you like crying and getting it out so then you feel better? And I'm like, oh, well, that's absolutely okay. Like that's what you're supposed to do. But we have to teach kids that it's okay for you to cry. It's okay for you to say that you're not okay. It's okay for you to talk about those things. And that's how we build resiliency within our homes, in our schools, communities, and families.
Love that honesty and transparency and building that space. I know we started a little late, but we're up against time right now, actually. So I see my colleague over there, Meryl, popped on. There's a couple of housekeeping things to put together right at the end there to make sure you guys get your credit. Thank you so much for joining us today. Thank you so much to the panelists. You guys gave wonderful expertise and experience across the board on a lot of different issues. There's a lot to tackle, but you were great partners today. Thanks to everyone who tuned in, and I will hand it over to Meryl to close us out.
Thank you. Thanks, everyone. And I got to I didn't realize my own name was spelled wrong. Like, and I'm sure I did that on my name as I was sitting off. That was pretty funny. Thank you for such a meaningful discussion. You know, I think our job is and our commitment is to support people where they live in the environments where they live. And whatever, you know, barriers may exist there, you know, we have a role to help people be themselves, right? And that's kind of where we anchor and maintain our presence. So just supporting people to be themselves and to feel good about who they are and help them, you know, to navigate that journey. So I thank everybody for their contributions to the discussion. Please let us know what other topics would be helpful to you. And we hope that you will join us again. I believe Sarah is going to put the information in the chat on how to get your CEs. Thank you for sticking with us. Thank you for helping young people to live well on their terms and to be able to participate and pay it forward for lots of other people coming along. So we are grateful and appreciative, and we'll see you next quarter, hopefully.
Thanks, everyone.